Welcome back. You are watching the Front Row. We're taking a look at governance in the devolved settings and, of course, a special focus on COVID-19, its management by the devolved units, lessons that we can learn even as we have a conversation around universal healthcare coverage in this country. One of the big four agenda for President Uhuru Kenyatta. Let's take a look at some of the things you're saying. Anonymous on Slido says, "Hello, Akisa. The Kenyan's healthcare system is rotten and warrants total cleansing. Think of how many government doctors own chemists just beside referral hospitals just to compel the public to buy drugs in the specific chemists. Just can't imagine the lack of integrity, morals and ethical codes." Well, we also have Michael Wanaoni who says the national government devolved health services to counties without devolving enough funds. Enough funds should be devolved to cater for health services. A lot of comments as well on Twitter. We'll be taking a look at that later. Let's now bring in Dr. Daisy Korir, Treasurer, KMPDU. Questions now around how then do we move forward? What lessons do we pick from COVID-19 as we now talk about rolling out UHC across the country? And then the question of enabling or building very strong systems in our local communities. Daisy, what are your thoughts?
Thank you, Akisa. I think for us to be able to build strong health systems in the country, we must be able to invest in the health workers, right from the community health workers. I think the biggest lesson we have learned from COVID is that when a pandemic hits the country like this, we can only depend on the health workers who are trained, well-motivated, and well-protected within the country for them to be able to treat us. As we noted, flights were cancelled and people could not go abroad to get treatment. So if you don't have the specialists that you need here, then you will be in a difficult situation because you can't fly out to look for that doctor elsewhere. So we better build confidence in our own health system by having our health workers well-trained, well-motivated, and let them also be well protected. I think as a union, we ran a small survey the past 1 week to just find out how the healthcare workers are doing. And because of even this delayed disbursement of funds to the county governments, majority of them have not been paid the June salary, some have not been paid the July, 2 months in a row, and yet they are now working in the front line. So coupled with lack of enough protective equipment, there is a delay in salary payment for over 2 months, and we still expect the same healthcare workers to serve us, and to treat us in those kinds of situations. So apart from that, we're also having, of course, their welfare issues, which have not yet been addressed. Even as we say, we are rolling out UHC. So if we don't address the welfare issues of the health workers, right from the dispensary, the nurse at the dispensary, all the way to the specialists in the big hospital. If we don't address their welfare, it will be very difficult for them to serve the country and to shield this country when we have such a big pandemic. So I think the way forward would be that, yes, there is good collaboration between the national government and the counties at the moment because of the increased dialogue since COVID began. But I would propose that we have a centralized way of managing these health workers. Whether we can go by, what Professor Nyong'o said, where you have health service commissions, several of them. But at the end of the day, are they going to use one formula to take care of these health workers? Because what we've seen happening in the counties is there's prioritization of procurement of equipment, and hospitals and beds. But no one is prioritizing these healthcare workers. And therefore, you're ending up with demotivated health workers. You're ending up with health workers who are even having different contracts. Yeah, you may find one county is employing them for UHC on a very low, salary. We've employed some of them this time around because of UHC. They were brought in to try and fill the gap that we were experiencing because of the pandemic. But if you see the contracts these doctors have been given, they've been given very small contracts where they're earning very little amount of money, yet they're being plunged directly into the isolation units to start working with the COVID positive patients. And at the same time, because of these poor contracts, they don't have a way of being compensated if they contract the disease or if they die, God forbid. And their families are just left like that because the contracts that they've been given are temporary, maybe 1 month, months. And so there's no way of compensating them once they contract the disease, for example. So I would agree that we need a centralized way of managing them. Whether it will be formed jointly between the county governments and national governments, and you have one intergovernmental body that manages the health workers, we must have that central body, okay? I know many people cringe when we talk of Health Services Commission, but our using the word Health Services Commission is just envisioning what, maybe like the Teacher Service Commission has done. But what we are talking about is a central body that will be able to manage these health workers so that we don't get the disparity that we are having now, and we are able to have health workers in all levels or in all counties who can be able to tackle a pandemic like this one, where you have to rely on your own. And I think also, if you want to strengthen the health systems, there's this group of health workers who are called community health workers, learning just from even the home-based care management that we have adopted as a country for managing COVID-19. We realize that when you say home-based care management, it means the patient is being managed from home. So you cannot have a doctor, for example, in a big facility, going to the home of that patient to see the patient every day. Maybe there are thousands of patients.
Right.
So you would have to rely on the low-level healthcare workers, which could include, the community health workers, to be able to report on these patients and monitor them and link them up to a referral system,
Right.
whereby they can be picked up if they deteriorate. And so you must find a way of strengthening these community health workers, motivating them and having them to linked to the bigger facilities. And also you need to have a very good referral system, right from the dispensary all the way to the county referral hospital. Yeah, because I realize that at the moment we are overburdening the two national referral hospitals, that's the Kenyatta and Moi. So if all the counties have their county referral hospitals working well and there's a good referral system, then we'll be able to strengthen the healthcare system.
Right. A lot of Dr. Korir, a lot of issues bedeviling the healthcare sector, right from the national government to the county governments, that we're now talking about rolling out UHC across the country after the pilot period in the 4 counties. What then does it mean for this project that the government has pumped in billions of shillings to go into?
So I think the many issues that the healthcare workers are facing are historical. I think in the recent past, we've been trying to discuss with the county governments to see how we can solve them. But looking at these issues, they are historical. They did not begin today, okay? These issues are just becoming an issue now because the health workers are also stretched, they are tired. In the recent 2 months, we've had delay of salaries for 2 months. And so the issues are coming up. But these are historical issues which have been there. And the main issues being issues of delaying salaries, lack of promotion, lack of training, okay? Then lack of medical insurance. I think it's important to state here that most of the doctors right now who are managing COVID, for example, when they get COVID themselves, they do not have any health insurance that can allow them to be in any hospital, in any government hospital, and get treated for COVID. So you see, these issues are historical, and they became worse when health was devolved, because that back then, health workers had one civil servants medical cover, and they were covered. But after devolution, we somehow lost it, and the people who were employed into the counties after devolution, they were not placed in any form of health insurance. So when you look at all these issues, they are historical, but we've not managed to address them with devolution. We have just increased or multiplied them because of 7 now different entities trying to solve the same problem, but solving it in a different manner. So in my own opinion, UHC is not working and will not work if we do not address the issues bedeviling health workers. And how do we address that? By having one central body that can be able to synthesize these issues, come up with resolutions, and implement them. I think the discussions, I've sat in so many discussions myself, all the way from 2016, 2015, and we've been discussing the same issues: employment, promotion, protection, lack of insurance, okay, salary delays, and we are still discussing them up until this moment with the county governments. But you see, when you're discussing with 47 people, for example, Kisumu has sent several people for training, okay? We have like more than 10 in doing 1 year in a specialist training in Moi University. But Migori, just a neighboring county, has only 1 doctor in training in the entire university. So how will Migori ever catch up with Kisumu? Okay, if we don't have a way of centralizing it. I know Prof is doing very well, in his county in that aspect. But you see, you can't compare that to the neighbor Migori because they are worlds apart. And so at the end of the day, you'll always find services in Migori or the other neighboring counties are at a lower level than the other county. So for UHC to work, I believe we must find a way of giving priority to our health workers and also trying to make sure that there's no disparity in how they are treated across the country.
Right, and of course, you also speak to a lot of leadership issues then to these specific counties and how governors are handling the situation. Governor Nyong'o, Kisumu had the privilege of being one of the pilot programs, and we've heard the other speakers talk about all these issues bedeviling the healthcare system and posing a threat to the success of UHC. What worked? What did not work? What lessons can we pick from perhaps counties like Kisumu that played a pilot role in this quest for universal healthcare coverage?
The good news is that we at the Council of Governors are doing an appraisal of the experience of COVID-19 and how, given the crisis that COVID plunged us in, we must look at a recovery process for all counties in the coming future. This includes reappraisal of the experience with universal healthcare in the pilot counties. And I'll tell you, yes, it was not successful, and pilots can be successful or not successful. They can be somewhere in between. But I don't think the UHC pilot was as successful as you would have expected for many reasons. But that having been said, the most important thing is to make a conclusion from clear evidence and analysis. The clear evidence is the following. One, that the funds for the UHC, as again, was not there in full. In Kisumu County, for example, we received about 70% of it, and quite often not in time. And secondly, the human resources needed to run the UHC effectively were not there adequately, and that's one of the reasons why during this COVID-19 time the national government decided to add human resources to counties, who are called UHC workers or UHC nurses and so on, so that there's enough workforce to deal with both COVID-19 and the usual healthcare problems that UHC should be addressing. So I would say that I'm always an optimist, This experience should tell us to learn from the problems and provide solutions for the future, and they are myriad. So I think the best thing to do is wait until we come out with our study that we are doing with KIPRA, Kenya Institute of Public Policy Research and Analysis, in a couple of weeks, which will address most of the issues and offer some suggestions for where we go from here today. But finally, I agree with Dr. Korir. You see, we must mix technology with human resources. One of the things we learned in Kisumu County that during this COVID-19, information and access to information was extremely important for healthcare workers. We had the call center, which we established at Mombasa University, which you could call and tell us that, well, there's somebody here who is about to have a baby in the middle of a curfew. What we do? Then we send an ambulances which are moving hospitals. The ladies collected, taken to a health facility. Some people are calling for other kinds of problems. We also had an app where individuals can check their health status to find out whether they have some symptoms for COVID-19 or not. And then the community health workers were taught how to use this technology and advise people at the local level. And they adopted very fast. I must commend our health workers for being very inventive and very adaptive to this difficult situation. And that's what we must learn. In Cuba, if you go to medical school, you must qualify first as a family doctor. That's a basic thing. And that's why Cuba has such a good health system. And we can learn from the Cuban doctors who are here now. So I would think that, one, in terms of how to manage health professionals, let us learn from the universities. The university don't have a central place where all lecturers, all professors are promoted, paid, and so on. Each university has a senate and a university council. But then they also have an inter-university system where certain professional standards have to be kept. So I think we have institutions in Kenya which function very much like counties do, very much like health facilities do, called universities, which we should learn from that system and adopt it to our own. Because devolution is a major milestone in improving governance and self-service delivery in our nation. It is too early to say whether devolution has worked or failed.
Okay, Governor.
Finally, I would say the following.
Yes.
Finally, I want to say the following. You know, there was an American journalist who was called Edgar Snow. He was specializing in the Chinese Revolution. In the middle of the 50s, he asked Chairman Mao, what can you learn from the French Revolution, which occurred in about the 18th century? And Mao said, it is still too early to tell. I would say it is still too early to tell whether we have failed to solve these problems. I think we have not. The problems are there, but we can solve them by working together as we have started working with the national government, and not have us and them attitude towards the disbursement of resources. After all, if resources are disbursed to counties, you are helping Kenyans to build a prosperous nation. Kenyans live in counties. They don't live in the oceans. So I think this attitude that has existed where the national government want to retain resources for bureaucratic consumption,
all right,
I think we should forget about it if we're going to build our nation.
Okay, Governor, I'd like to give the rest of the panelists, thank you, a chance to give us their closing remarks. P.S. Sunkuli, give us your closing remarks and the way forward, perhaps, as we close.
Akisa, this has been a very interesting discussion, but I want to emphasize the need for counties to be strategic, for all of us to be strategic, both national and county government to be strategic on three key issues. One, to be strategic, to focus more on primary health care. This is what COVID-19 response intervention have taught us. Number two, to strengthen on synergy building between the counties. Number three, to strengthen digital information sharing between the healthcare centers so that we are able to support one another where there are gaps. And I would like to see this happening in the counties in coming days. And I know that through the Intergovernmental Consultative Forum on Health, which this ministry coordinates, we are going to push for a more strategic approach to not only COVID-19 response, but to the healthcare provision in this country. Thank you very much.
We'll hold you to that, PS. We'll hold you to that promise. Thank you very much. Wanjiru, give us your closing remarks. In a minute, we don't have a lot of time.
I'll go to accountability because a lot of good things have been said. We need to focus, and it was one of the resolutions from the meeting yesterday, open contracting. We need access, we need better collaboration between the citizens, civil society, and local communities. We need community health workers to also get involved in governance. We need project committees able to monitor procurement, because what we are finding is that vested interest in the budget process is driving investments into infrastructure instead of responding to the real needs at the local level. That's an accountability issue. So we need to move away from what we are seeing, quite a bit of lip service at the conference level. We need to begin scorecarding counties. Have you opened up? Are you working with civil society? Are those contracts open? Are we able to track? Are the funds traceable? Are project committees approving before payments are made, so that we can move from theory to practice? Thank you.
Thank you very much. Dr. Daisy Korir, you'll give us your closing remarks, perhaps what you hope to see in the coming days.
Thank you, Akisa. I think in summary, just as the UHC pillars that we have, I think we should find a financing strategy that works. Let us focus on a system where citizens do not have to pay out of pocket. I think I agree with the professor that maybe we need to have a national health insurance instead of hospital. And then we should have well-motivated, well-trained and efficient workforce, okay, in all the areas or in all the hospitals that we have.
All right.
We can only have that by having a central body to manage them,
Okay.
and also employing them on very good terms, not contractual basis that we are
Okay.
seeing at the moment.
Great.
Thank you.
Thank you very much. Great voices we've heard tonight here on the front row. Governor Anyang' Nyong'o, Kisumu Governor. We've had PS Devolution Charles Sunkuli, Wanjiru Gikonyo, National Coordinator of the Institute of Social Accountability, and Dr. Daisy Korir, the National Treasurer of KMPDU. Ladies and gentlemen, thank you for helping us break down this subject here on the front row. And that's how we wrap it up. Thank you very much for joining us here on the front row. I'll be seeing you next time. I am Akisa Wandera. Have a good night.